about why we do this work that we do, especially in within this committee. So I just like to start with the grounding of why this group exists. Our mission is to continuously improve the quality of HIV services in the Cleveland TGA using data, collaboration, and action. So today really isn't just about the updates that we're going to go through. It's also about reflecting on the work that we've done over the past year. We're also, as an objective for our meeting today, we're going to reflect on the work that we did the past year, also celebrate our progress, and make sure that the goals that we're going to carry into 2026 reflect the real needs across the TGA. So this is why it's so important that we meet together as a committee to kind of shape this work that we're going to be doing moving forward. So it's not just kind of top down from health department to committee. We really will work together as a collaborative entity to shape our goals moving forward. And also just as a quick refresher, because I know it can get a little bit word salady with all the different acronyms. So just to kind of give a little reference, we do have our clinical quality management overall program, which is more of like the overall system, plans, measures, improvement work that we do that's required by HRSA, and encompasses also data monitoring. But inside of that overall program is also our Clinical Quality Management Committee, which is the committee that's meeting today. And the CQMC, or the Clinical Quality Management Committee, is really the voice and engine behind the quality improvement work that we're doing, really responsible for reviewing the data that we're pulling as an overall program, sharing agency experiences, sharing lived experiences, and also helping to shape the priorities as we move forward in our improvement efforts. This distinction does help, especially as we're going to move into talking about how we're going to shape our goals in the next year, because those goals really are also co-owned by the committee members, not just by the recipient office. And I thought also to add some additional framework, this visual is kind of how we have historically structured our Clinical Quality Management Committee. I'm not sure if you can see it very well, since I know it's going to be a little bit smaller on a Zoom screen. Our quality plan will eventually be sent out, which you can also see this. But it just kind of is a good diagram that illustrates kind of where our committee, where everybody kind of falls. So it's not truly hierarchical, but it does illustrate that we all play an important role, all the way from Zach, who's sitting at the deputy director's office, to all of our stakeholders in the community, as well as everybody in between, which is comprised of our subrecipients largely. And this is just a good way to also kind of keep in perspective and check back on to see who else are we not maybe engaging with as much as we could in our committee work and our quality improvement work. What are other voices that we could bring to the table? This is something that I think we really need to explore into the next year, as largely this committee has over the past 2 years been made up of pretty much only subrecipients. So we've kind of missed out on some of those other perspectives from non-funded entities within our community. So working towards engaging those folks that can bring a new perspective and also just new resources and skills to the committee, I think will be really important for our work next year. And I also do want to just acknowledge as well, over the past few years, there has been a lot of changes within our agency as well that has kind of led to this committee meeting on a bit more of a sporadic schedule. That's something we also are moving away from into the next year with a more structured meeting schedule. So hopefully we can continue to build up our infrastructure through this Clinical Quality Management Committee as well. All right, so let's do a quick recap into 2025. So in 2025, a major focus for us through the past year was kind of diving deep into understanding more our performance measures, especially how they're captured in CareWare, and ensuring that we're working from reliable data. And this kind of became foundational to the other work that we were doing over the past year. So before we get into that, sorry for the pop-up over there. Um, I figured we could do a brief evaluation of our CQM plan from last year as well, kind of the overarching goals that we had established. So we did meet two of them. Two of them are kind of more continuing on into the next year's goals. But in our previous work plan, we had established that we wanted to focus on building our comprehensive and functional quality infrastructure. So again, that was that sort of structural committee structure that we just reviewed, but it also encompasses the other work that the committee is doing, including the CQM plan, all of our stakeholders being present, having the acumen to carry out programmatic work and QI work as well, which I know was broken out into separate goals last year, but it does become kind of redundant. So we were able to do that. We did meet as a committee regularly. We did also work on strengthening our internal committees as well. And so we were able to, with our sort of built foundation last year, move into sort of the next phase, which was improving data management, integrity and utilization. So that was where we really focused a large part of our effort last year. And we really made strong progress towards improving the data that we were not only using, but also understanding the performance measures that we're using to measure our success and our patients' health outcomes. So that was a big part of last year. And then we also did start to work a bit towards establishing a culture of quality improvement and improving subrecipient CQM acumen, building in some just-in-time learning into some of our meetings, using some additional quality improvement tools such as key driver diagrams and prioritization matrices, as well as developing our SMART goal and our aim statement together as a group. So we did do a little bit of building, but we're definitely going to focus on that into the next year as well. And then this is sort of just a larger high-level picture of our accomplishments that we worked on last year. So at a high level, we really, again, we're going kind of deeper into what the data is telling us, really taking a closer look at CareWare performance measures and how we define and identify clients who may be out of care. We did this by working deeper across agencies. So last year, we really did work towards a truly collaborative TGA project where we structured our aim together as a group. We focused on our OAHS providers for this particular project focus last year, worked on developing our aim together, and then worked on identifying ways that we could better engage folks who were not considered retained in care per the performance measures that we pull from CareWare. So again, it was continued focus on retention and care. And then I'll dive deeper in a next slide, but we did this through creating cohort lists and going through them and really trying to get some answers as to why certain folks were coming up not retained in care, where they may actually be retained in care. So this is kind of what we spent a large portion of last year working on was patient cohort lists. So our wonderful epidemiologist, Alicia, was so kind to, for each agency that was funded for OAHS last year, pull out all of their patients that were considered not retained in care, which for those who might not be familiar with this particular performance measure is retention and care is when somebody has 2 or more appointments, medical appointments, or labs done within a year period, at least 90 days apart. This is traditionally kind of one of our more, to be perfectly transparent, frustrating measures that we monitor here in our TGA. Largely, folks who have been established in care for a long time are long-term virally suppressed, don't necessarily need to have 2 appointments a year. So how do we look at the list of people who aren't in care, but also consider that some folks might be long-term virally suppressed? And then how do we also identify, just based on data entry errors or other things that might not be captured on the back end of CareWare, who's truly out of care so we can really dive deeper into the why they're not in care. So we were able to identify individuals that were out of care through this process. Once we were able to filter out for folks that actually were in care and change that information in CareWare, we were better able to understand those patterns in engagement. And then we were able to work together as a group to help start to inform our outreach efforts and QI work. So we did that by working on a key driver diagram together and identifying some potential change measures that we wanted to employ into the next year. And this really did help us sort of drive who was misclassified based on data entry issues. Which brings me to my next accomplishment for the past year. We really were able to drive a large improvement in our data integrity through this process. Um, while we may have not gotten to the point where we're actually implementing PDSA cycles, we made a huge impact just through cleaning up the data, and we're really able to more deeply understand the measure and how it's pulled. This allows us to really increase our confidence in our performance measures in general, so we can make sure that we're focusing our QI efforts where they're really needed most. Um, it's allowed us to have fewer data discrepancies between what we're seeing in CareWare, our reporting system, versus what folks are seeing at their agencies in their electronic medical records or in their clinical data. And it will only help us improve how we are able to frame our QI work moving forward. So this was a fantastic improvement to our process just by simply cleaning up the data. And then I did want to give a shout out to through this process, we were able to achieve and sustain over the last 2 quarters a 3% rise in retention. So that might not seem like a lot, but I will say when we did come up with this project last year, our initial aim was 2%. So we did actually surpass our initial aim, our initial goal of 2%. And we have sustained this improvement as well. So that's really important too. Sometimes quarter to quarter we see drops, but we haven't. We've been holding steady at 73% from 70. And this is really important and really impressive as well because it is also the first true upward trend in retention that we've seen in multiple years now. So I only see this going up from here, and I think it was really, really fantastic the work that everybody was able to do on these cohort lists, and it clearly made a huge impact in our overall numbers. So I just wanted to give everybody praise for that because that is a very huge accomplishment. And then, yeah, so just to kind of to close it off, what we learned this year, just a few key lessons. Really, we kind of like I said, spent a lot of time on data quality and data integrity. So we really kind of learned about why data quality is really a prerequisite for the improvement work. Because really without it, we risk not focusing on the areas that we need to be putting our focus in at that time. Even something as small as changing how data is input can really lead to large measurable impacts, as we can see just by returning to those cohort lists and cleaning up the data. We've made a huge improvement in our numbers over the last year. And then something else that I feel like I took away from this last year is just the importance of regular engagement, especially as a committee, is really vital to having that strong foundation for our overall CQM program. And it will be essential to sustaining our progress as a group as well. So with those lessons in mind, I did just want to shift us to looking ahead. I did also want to invite anybody as well, if before we go into the next phase, if anybody else had any reflections over the past year that they felt like sharing, I just wanted to welcome them to feel free to make any comments, or if you have any comments or thoughts, you can also drop that in the chat as well. All right, so we'll just move forward then. All right, so shifting into ahead, so looking into 2026, our goals and priorities. We really wanted to move forward, grounded in the goals from last year and what we still needed to build on and improve on, but be a bit more intentional with it, to make sure that our goals weren't redundant, as they kind of had been in the past couple years. So we're still building on the progress from 2025 and still working towards aligning with our evolving needs as a TGA, and then also working towards strengthening engagement. But for the next year, we met as an internal clinical quality management committee, to kind of identify some high level overarching key priorities that we would like to look at into the next year. And just for some context, our internal committee is currently made up of Zach LeVar, Anastasia Idov, Ellie Falter, who's the newest member, Alicia Cassidy, and then also myself. So we work together to kind of go through as a group to kind of identify goals that we're going to focus on into the next year. And we wanted to share them with you today so we could get some feedback from the committee, to further shape these goals so we can make them more meaningful for the group moving forward. So again, just at a high level, our 2026 priorities are going to focus on three general areas. And these general areas are areas that are required by HRSA to be components of a clinical quality management program. So we just wanted to use that as the overall framework for our QI work moving forward. So basically, we're going to focus on strengthening our infrastructure and engagement, improving how we're using data for decision making, and then work on carrying out more targeted quality improvement activities that will improve patient outcomes. And I know this is a lot that we've already just gone through. So I did just want to open the floor if anybody had any thoughts on potentially any additional new or emerging priorities that they've seen, within their offices, or things that we also need to be keeping on our radar as we're moving forward in this conversation.
So when I don't know if I have something that's going to add to the conversation, but I was thinking when you were talking about people living longer, maybe using that and using their networks. And I'll use an example of there's a lot of support groups around, and maybe having the person who heads up that support group be engaged with asking people, have you been to the doctor lately? Using those networks to encourage people to keep their appointments. And if they need help, to ask that help, or what is a deterrent for you keeping your appointments. And maybe coming from that framework. I know I sit on the planning council and we talk about that all, well, the CLC committee talks about how can we help. And I was wondering if that could be a possibility woven into the CQM project. I don't know what it would look like, but that was just some thought that I had about using communities and their networks. Um, it might not change a lot, but it could, because if you hear stories of people keeping their appointments and encouraging other people to keep theirs, especially for newer people, it might persuade them to take ownership to their health care. And that's part of it too, taking ownership to your health care, because people can't do it all. I mean, we're social workers, a lot of us get money to do that, but we're talking about adults. We're not talking about kids. And so we need to be able to get them to buy in to taking responsibility for their own health care. Okay,
Uh,
I'm done. I'm
no,
done with rambling.
no, absolutely. And Naima, every time you talk on meetings, I'm always so thankful for you being here and engaging with this group. So thank you so much for your input. I definitely think that we should explore that more, as we're building our QI projects into next year. So definitely that's something that we can work towards. Anybody else have any thoughts? All right, so I'm going to go a little bit deeper into each of these kind of identified goals to give a little bit more context to them too, since I know we just kind of went over a high level overview of them right now. So under our infrastructure sort of priority focus area, we did identify 2 goals to work on as an internal committee into next year. So these goals are really from the infrastructure standpoint, focused on promoting more active engagement in the overall CQM program, as well as establishing a more formal and focused process for reviewing and revising the CQM plan, which these goals do fit into. So this would include strengthening CQMC participation, supporting training and capacity building, and continuing to refine processes and tools that we use as a group. Some of the things that we talked about, how we talked about implementing this, would be to work on recruiting and onboarding new clinical quality committee members, with an emphasis on recruiting people with lived experience and people living with HIV to be part of the committee, since really it's necessary for our work to have people with lived experience at the forefront and of the decision making. So we want to work towards that, or we are going to work towards that. We also did want to make sure as well that we had mechanisms in place to help us retain existing CQMC members. And largely when I'm talking about that, I'm talking about subrecipient agencies. So really to have subrecipient input and committee member input on what's working with the committee and what's not working, so that we can make any continued changes to support participation overall. Um, so basically just to encourage participation from new people and to also support continued engagement. Um, that is the first round of goals that we have identified. And I figured we could just do a little discussion based on each one of these kind of priority infrastructure, performance measurement, and quality improvement identified areas, just so that we don't get to the end and we lose sight of the goals we just reviewed. Just wanted to get kind of a temperature check from folks if these goals feel realistic and relevant into next year. Even just a thumbs up or a thumbs down in the chat works too for temperature.
And Melissa, I don't know if you are planning to mention it later, but you had mentioned that we're gonna be doing a more structured like cadence to CQMC meetings. Is that involved in these goals?
Yes, so that also is we also have more structured cadence. So instead of sending out meeting invites a month before they're happening, you're going to have the full year of meetings before they occur, how long they're going to be. We're working on also pre-planning agenda items for those meetings too, so you can really take note of who on your team would be the most appropriate contact to have attend those meetings. Because while funded subrecipients are required to have representation, we want to make sure that it's still useful for the folks that are going. So we understand that oftentimes to meet kind of that contractual obligation of attending, somebody might just get tapped to attend, but it might not be useful for you. Okay, I just saw your comment, Kate. But we want to make sure it is useful for folks. So we're trying to be more intentional with not only the meeting structure, but also the meeting cadence. So it's more useful for you folks as well. Zach, I hope I hit on what you were trying to mention earlier. I can't remember if I have it explicitly stated later.
Yeah, thank you.
Melissa, I think you might be able to see it, but you have quite a few thumbs up in the chat and a few thumbs up reactions. So
Okay, cool. And again, if people do not feel good about goals, this is also a free space to also share that as well. Or if you have additional thoughts or need additional clarity, we really want to work together to make sure that these goals are shaped by all of us. I will move on to the next area. So this one is performance measurement. So this focus area, we really wanted to center the goals on piloting a standardized CQM monitoring process. And I know that sounds a little bit jarring at first, but this is a HRSA requirement. We do have to establish monitoring into the next year for CQM, but I will say it is not the same as our programmatic monitoring. This is more of a routine, regular check-in to see where your agency is at as far as quality improvement work, making sure that you're attending required meetings, and then identifying other support needs as well. Since we have not historically had a standardized process for this in the TGA, we are going to be working on building that out this year and plan to kind of pilot the initial conversations during program monitoring next summer. But again, it's not the same as your agency didn't meet this, so you're going to have a finding. It really is more of a collaboration and to figure out what's needed to help everybody be successful in the CQM program. Just wanted to give a little bit more context to that, since I know monitoring sounds a bit scary sometimes. So we also wanted to, in this priority area, work on establishing baseline measures for selecting and tracking QI project outcomes. This goal is really about making data more usable, not just collecting it. So ensuring that, again, that our data is valid, that our data is entered in a timely fashion, kind of just building on the momentum from last year, just so that we can have ensure that we have accurate performance data entry, and that we can further align our CareWare data with our clinical and electronic medical record data. And then also, because this data does end up getting reported back through RSR into HRSA, it is also really important that the data is true to what you guys are doing, because we want to continue to get funding. And this is one of the ways that we can show HRSA the very important and amazing work that you guys are all doing. And I wanted to open it up for any questions here as well, or any thoughts. Does anybody have any hesitation about any of these or any feelings on them at all? And it's okay if you don't have them right now. We can also collect feedback afterwards later, once these are kind of digested, but I just wanted to open the floor if anybody had any more immediate thoughts. All right, so we'll move forward. And then, so our last sort of priority area is quality improvement. And again, this feeds back into kind of the idea that Naima was talking about. So this is really about the quality improvement side. And this goal is really just to carry out our QI activities in a way that directly improves patient outcomes. So making sure that these projects are aligned with TGA needs, and that they're supported and structured by structured QI methods and tools. Thanks, Kate. For some reason, I think I'm only seeing Kate's comments in the chat, but I think Ellie said that there were some other earlier. All right, so one of the ways that we hope to do this is just by engaging subrecipients in QI projects. And where the CQMC will come into play with this is really helping us identify our annual TGA-wide project topics and aim statements for our service category projects. I do want to also give the caveat as well that while last year we really tried hard to have TGA-wide project that had the same implementation across the aisle, it's not really realistic for our TGA. We have a lot of variation in the size of our providers and their capacity, and just the way different agencies are resourced. So while we will be coming up with our service category project as a group for our TGA-wide project, it's going to look more like how projects look in the past, where the agencies will then come up with how they're going to implement these and their own sort of objectives or goals to reach that ultimate aim, if that makes a little bit more sense. And I think that will be easier for folks too that might be working on other QI work already at their agencies, where they can kind of wrap it all into one. That way you're not duplicating efforts as much, hopefully. We want to make it so it is still innovative, but also, easy for people to take part in it, especially as staff members change and resources change throughout the year as well.
Well, this is Kate. I just wanted
Okay.
just want to jump in and say thank you for that, because while we can all have the same goal, you giving us kind of the autonomy to figure out what works best for our own agencies is really helpful and appreciated. So thank you.
Yeah, absolutely. And I will say our conversation during monitoring at UH was very helpful in that. So thank you. I always appreciate your feedback as well. But yeah, we want to make sure that people are able to participate, and it's not a redundant or duplicative effort. That doesn't necessarily help with anything innovative. That just can be busy work at the end of the day. And we want to make sure it's useful and that you're able to share something that your agency is proud of, and you're able to show truly important and fantastic work that you guys are already doing. Which is also why, as part of this too, we're going to make sure that we are doing highlights during at least 2 of our meetings in the year. So we really want to highlight the work that you guys are doing. We didn't have time today on this call to do it, but I know that there are some really cool QI projects currently going on at different agencies. I know that UH has been working on with Medicaid and Medicare, I believe. Signature Health has a whole data dashboard that they've built into their EMR. There's other agencies working on national care collaboratives right now. So we're just really excited to highlight that work more, but then also highlight the work that we're doing within the TGA projects as well. So that's something that I'm very much looking forward into the next year. Does anyone have any other questions or feedback on the quality improvement sort of priority area for next year? Oh, okay, cool. We'll move ahead then. All right, so we kind of already did our discussion like built in. I just wanted to make sure as well that we were not only making sure that these priorities feel right for our TGA, but really wanted to acknowledge and consider any capacity issues or any other things that we might not be aware of working at the recipient level that we should be mindful of as we shape these goals for subrecipients and our committee into next year. So I didn't know if anybody had any feedback on that. Again, you can always provide it afterwards, but I just wanted to give the platform out there for folks to share any considerations they might have.
Well, for me, I think one thing that we should consider is that some agencies are smaller and larger than others. So UH and Metro are probably a match. But places like the centers or other places who only have like maybe 200 patients top, what they do and how they do it, we should take that into consideration. And also the fact that people are leaving their job, which only some people have one social worker representing a certain amount of people, and other people have more social workers to do the work that they need to do.
Absolutely. And that was a big consideration that we talked about when we were outlining the goals, especially for quality improvement. We really want to make sure that agencies that are resourced differently or have varying capacity levels are still able to participate in a meaningful way, even if they don't have a full back-end QI team, staff. Maybe they're just made up of one medical case manager and they're just doing the QI projects themselves. We still want to make sure that we can support them as a committee, so that they're able to do meaningful QI work. So thank you so much for that. That's definitely helpful, Naima.
And then the other piece, since I love to hear myself talk, um, is the fact that I am one of the co-chairs of the CLC committee, and we would love to know how we could help. And we could probably factor that into the work that we do next year, because we haven't come up with our goals for 26. And so I could definitely bring that back and see how people might want to get involved, because I consider us a gatekeeper because we help, and a lot of us has been doing this work for a while. We help with being the voice of people living with, to um, to align with some of the planning council agenda. So if that's something that we might be able to do, I don't know, Zach, if you could tell us yes or no, or I'm sorry, me, so that I know that that's not something that we can do, or I can bring it back to our meeting in January to see where we might be able to help. Because we've done listening sessions in the past, we've done surveys in the past, and maybe we can reshape it to gather some of the information that you all want on how to keep people in care.
Hey, I don't think I have to be the one to tell you yes or no on that, Melissa. Melissa has actually got things in her planning process to engage CLC and people living with. So that's all going to be coming out next year if she has any thoughts that she wants to share now. But yeah, I'm not going to say no to that ever.
No, I am so happy that you mentioned that, Naima. It has been definitely a priority of mine to better work collaboratively with CLC. I would love nothing more to do that. So if there's any sort of opportunity to work together, I'm always open to that. And I'm the committee in general. I'll just speak on behalf of the committee. We would also love to work with CLC as well. All right. Any other thoughts on any of these goals? I think that because they're pretty high level and they haven't changed too much year to year, they're just a little bit more, I guess, strategic, I would say, than the last couple of years. I think they're really attainable for us. But again, I do want to get feedback from you all since the committee is really in charge of also shaping our CQM program. So I will be sending out a Microsoft Forms survey that will allow for any sort of anonymous feedback for folks that might not feel as comfortable coming off on a Teams call, or putting their thoughts in the chat, and also so that people can have a little bit more time to kind of digest the goals and see if there's anything else that they think would be fitting moving into the next year. All right, and I did also just want to briefly highlight too, how this committee kind of fits in to the implementation of these goals and of our overall work plan. So this is kind of just very broad, brief kind of overview, but basically members on this committee are tasked with shaping our CQM program. And they do that by sharing their agency experiences during these meetings, really participating in the QI projects, data review and feedback. Also, subrecipient agencies are responsible for reporting that data as well and inputting it into Careware. And then also for agencies that might not be directly involved in a QI project, or for especially for new members into next year, training and capacity building activities are also going to be something that's important, just so we can have the acumen built up, so we can further build this committee as a whole, so we can carry out our QI projects. And so what's next? So I know I touched on it a little bit. So we do really want to incorporate feedback from this group as we finalize our 2026 work plan and our CQM plan. So I will be sharing that Microsoft Form survey with folks so they can provide some additional feedback then. And then we will be sharing these goals out. That way that we can have everybody look over them before they're finalized. And then we will also be sending out the meeting dates as well so that everybody can go ahead and get those on their calendar for the next year. So we can have those plans in place as well. And then I also on the next slide do have the meeting schedule already put up. So when I send out the slides, you will have this as well. But I did just want to open it up for any questions or comments or any concerns moving into the next year. Or any announcements as well from any agencies or from anybody here at the Board of Health that might have any sort of programmatic announcements on their end.
Hi, Melissa. I have a announcement. We are actively interviewing for a medical case manager and housing case managers.
You said medical case managers and housing case managers?
Yes, we have one position available for medical case manager.
Okay, perfect. Thank you, Kim.
You're welcome. Thank you.
Does anybody else have any announcements?
We are also at the centers looking for a second medical case manager.
Right. Well, awesome, everybody. Thank you so much for your time today. Again, I will be sending out a survey with the goals outlined so we can get some additional feedback. I just wanted to thank everybody for your time and your hard work this year. And I hope that everybody has a wonderful holiday and a safe and happy new year as well.
Thanks,
Have a happy
Melissa.
holiday.
Happy holidays.
Happy holidays.
Happy holidays, everyone.
Thanks.
Bye.
Happy holidays.
Bye, everyone.
Thank you.